this has been planned for months. How I met George himself, and this is the first time actually meeting him, was on social media, on Twitter actually. George became one of the fans of Vets Grow, which was a docu-series I put together in 2018 teaching a Vietnam veteran called Al Duncan to grow his own cannabis at home, fully legally. George was one of those that caught wind of it after a couple of years, and he didn't tell me what it was until we started exchanging direct messages. But that was when he first told me all of the stories about prohibition and the essential sabotage of cannabis research and all of the ugly stuff about cannabis research, you know. The fact that they're only until very recently they were only allowed to look at the negative effects of cannabis, not any of the therapeutics. So really what we're going into in a post-prohibition world is this era where cannabis is like a super material. And when I say cannabis, I include hemp into that. To me, it's a cannabis strain with a different word so that people on one side of the political conversation don't have to call it cannabis. But it's the same thing, basically. And as a material, as a pharmacological wonder, I genuinely believe that the next 10 to 20 years, cannabis is just going to change the world. And really, a lot of that change will be thanks to the work put together by this company. You know, George himself is a Navy SEAL. But I guess that's what you need, the sort of clout you need to have in order to get a DEA approved license. And so as soon as I found out what George was up to, and he said, "Do you want to come film it?" I was like, hell yeah. Absolutely no question. And that then gave me further ideas where research is and what the state of play is, the prohibitions, and the stigmas that are associated with researchers that try and investigate cannabis. Because the same way as stoners get lambasted by mainstream culture as being slackers and all that sort of stuff, that researchers, doctors, anyone in the sort of medical community, they get ridiculed just as hard about cannabis use and the idea of it as a medicine. Bit early. Oh, there you go. They probably saw the camera.
We'll go, we're right here, right now, in the admin area. And for planning purposes, I was thinking it'd be easier to do this, just show you sort of the process flow. We'll go out here. Once we go out into the production area, there's really no coming back out because we'll be totally gowned up in
You've got
protective
full
gear.
bunny suits, yeah?
Yeah.
Oh, wow.
And the room flow from a cleanliness perspective, and this is where it'll require some planning on you guys' part, is we'll come out here and to the left, and then once we go out of this room, we really shouldn't be coming back in and out of these. So I know you mentioned
It's a one-way pass, right?
Yep.
Okay.
Yeah. For these, it should be a one-way pass. Now, once we're out of here, it's not a free-for-all, but there's much less risk of contamination. So, if you need to do 3 passes in here or walk and talk out here, a little more friendly out here. But with respect to the plants, once we're in there, we're in there. So that's why I'm showing you this so you can sort of plan. And then you can look at the cameras as well. You'll see.
I'm going to bring this in with me, and then we'll shoot the B-roll as we go. If we can only get in there one time, I don't want to bother busting the big rig out.
doing now is we're transitioning from the office and admin area basically into the controlled substance space production area. So what's important for us from a security perspective is that we're controlling the flow of personnel and materials such that we know that everything entering this building in the production area is clean, so that we can minimize the use of things like pesticides, such that researchers, doctors, hospital systems that are using our products can rest assured that outside contaminants, be it pesticide, fungicide, herbicide, etc., are not going into the production area. So what we're going to do now is clean ourselves such that we're not tracking anything from the outside world into the production area. All right, so what you're going to do is you're going to follow me in when we go in, sanitize hands, and what you're also going to do is I've already sprayed isopropanol sanitizing solution on the back of my clean production floor shoes.
Okay.
And you're going to put on shoe covers as well.
Shoe covers, right.
Yep. Okay. So we are now entering into the production environment. Come on in. Watch your step.
Yep.
Oh. No, good. No, step in.
I do need to step into
step
it.
in there.
Wasn't
I just
sure
don't
if
want you to trip. So this is a foot bath. Again, sanitizing anything that can be on your feet.
Yep.
There's two things we're really focused on here. Three really in terms of the Venn diagram of what we're doing. There's all these considerations around what the FDA needs to produce a drug. The other is the DEA, the Drug Enforcement Administration, our narcotics agency in the US, how they think about the production and control of a controlled substance. And then there's obviously sort of the most important part here, which is what's the optimal environment for producing clean, consistent, compliant cannabis. That Venn diagram doesn't like to talk to each other. So the intersection of FDA, DEA, cannabis production is actually quite small. So we've tailor-built this facility to meet all of those requirements, to optimally produce clean cannabis in a manner that the FDA, the Food and Drug Administration, and the DEA are comfortable with. This plays a part in that.
We look like we work at a deli. A really strict deli.
Very clean deli, yeah.
Super, super strict deli.
Cool. So now that we're fully gowned, effectively decontaminated, we're going to move into the actual production area. So what I'm going to do is open the door for you guys. We're going to sanitize our hands and then step through. When you step through, we're going to go through another foot bath. Again, just being hyper aware of tracking in any contaminants. So do watch your step. As you'll notice, biometric controls. Part of what we do here, as I mentioned, is appeasing the DEA from a security, a controlled substance production standpoint. So we make sure that only people that have a need to access and have authorized access get back there. So that's why we use our thumbprints.
Cool.
So here we go.
At least I don't have to hide from the door code.
Yes, exactly.
Questions. What are the major differences between this and a sort of regular cannabis farm, other than security?
The cannabis farms I'm used to are actually pretty about equivalent in Canada because it's federally legal.
Mm-hmm.
I haven't worked at any of the state legal operations, but they're definitely lacking all of the security that we have,
right.
All of the cleanliness protocols.
Difference between this and a traditional cannabis farm is one of the things we're most cognizant of, and frankly have to be from the FDA, the Food and Drug Administration's perspective, is our record keeping and our batch keeping. Mm-hmm. So Kyle, as our production director, logs and traces and measures effectively everything along the production process. So everything here is very tightly controlled and documented from a documentation perspective, because at the end of the day, we're producing a drug that goes into people for clinical trials. So we have to know the batch number of every nutrient that we put into the plants. And Kyle keeps a log of exactly that batch number, so if there were ever a recall based on one small nutrient, we could trace that back to every single one of our products and do a recall.
So you've got very different methodologies here, because you're not trying to just produce mass bud like most people in the cannabis industry.
Where the consumer in a state legal market is perhaps most interested in, the highest THC content. Certainly the adult use market, the highest THC content they can procure. For us, it's less about the consumer need and more about making sure that the product is clean and consistent every time.
Let's rock and roll. Yeah, I'm super excited.
Hit this again.
Again?
Yeah.
Well, that was creepy. Oh,
there we go.
This is cool. How many clones do you normally run in this system?
On this rack, it's roughly 2,000.
2,000 clones just on there. So you're not keeping them for very long in this space?
No, they'll be in here for 2 weeks at the most for clones. Seedlings are about 3 weeks.
Grab a set of glasses.
So out of those roughly 2,000 plants, they can all come in here. Planning on having a minimum of 1,800 plants in this room at all times.
Cool.
So 2,000 on the clone racks. We'll select 1,800 of the most vigorous, healthiest clones that we can, move them on into this room. They'll be packed in here at very high density. There'll be about 5 plants per square foot, basically touching. And they'll be in this room for about 1 week. So when we transplant, it's this small rock wool plug that we put into the larger cube. That's what will happen in this room.
Right.
What we're waiting for in this room is the roots to emerge from the bottom of the new larger cube. That's a signal to us that they're ready to go. They're ready to flower.
Right.
So once we see that, we're expecting that within 5 to 7 days. Then they're ready to move on to flowering. So the strategy here is to select roughly 1,500 to 1,600 plants from this room, move them onto the flowering room once they're ready. We keep the remaining 200 to 300 plants in this room, and they will be our mother stock for the following batch.
A lot of their research was frankly useless or irrelevant because it's great to study a 5% THC product in someone for medical or even adult use purposes, but if most folks are using cannabis that's 10, 15, 20, 30% THC, the research should reflect that. So these varietals are analogous to what you would find in the state markets. They're also, what has us the most excited, honestly, is that they're entirely federally legal and authorized by the DEA. So we can ship these plants, which have more than 0.3% THC. We can ship these plants and their derivatives, oils, isolates, etc., internationally and across state lines with full licensure from the federal government. So these can go to researchers around the world, pharmaceutical biotech companies in the United States, or even public policy researchers. Love that smell every time. That is incredible.
Did you come up with all of this? I mean, we could talk about that as we walk, but what's the history of the company? How did it come to pass?
I served as a Navy SEAL for about 7 years overseas in Afghanistan and other places around the world. Left the military. It was a fantastic experience, loved everything about it, but left the military. And after I left, I got involved in the healthcare of a very close friend of mine, a very dear friend, fellow special operations veteran. And I started going with this person effectively as their advocate, their scribe, their patient caregiver to the VA, the Veterans Affairs Hospital. The VA is one of the world's largest buyer of opioids, ironically. My friend was effectively at the end of his rope and said, look, I'm done with all the treatments. I think I'm becoming addicted to all my different therapeutics. I'm gonna try this medical marijuana thing. This is about 3.5 years ago. I'm gonna try this medical marijuana thing. Can you just tell me, where do I get it and how much should I use? And the doctor looked at him and said, look, at the end of the day, it's not gonna kill you, but for me as a doctor to adequately counsel you on this would be really irresponsible. We don't have the data to treat this as a medicine like I'm used to doing. My friend was predisposed to mental illness. He was already using opioids for chronic pain. And the doctor was like, look, anything else I were to recommend or prescribe, we know how those things interact. We know if a particular drug makes your predisposition to mental illness better or worse, or how it interacts with the opioids. Does it create craving? We don't know any of that stuff with cannabis. And that really shocked me, and I was like, wait a minute. At the time, Attorney General Jeff Sessions, said cannabis was the same as heroin. Meanwhile, you could get it delivered in California in like 6 minutes through Ease, the Uber Eats of cannabis. What did this doctor mean? One of the most preeminent doctors in the world at the VA in Palo Alto, attached to Stanford University. What does he mean? We don't know. 200 million Americans were living in a place where they could access cannabis as a consumer, but a doctor couldn't, a hospital couldn't. What do you mean? And the reason was institutions,
hospital systems, medical professionals are regulated by federal law, whereas consumers can follow state law. So that there was this massive disconnect between what consumers were doing and what scientists and researchers understood. And so we came up with BRC, Biopharmaceutical Research Company, to say, let's go through the federal process, follow federal law, follow DEA law and FDA guidelines, and if we can crack the code on how to produce federally legal cannabis that can go into humans for legitimate scientific research, there is a monstrous opportunity from a business side, and more importantly, to educate the scientific community and help people. We don't prejudge any of the science. If cannabis is good for certain people, let's figure that out and let's maximize it so that we can help the most amount of people possible. It's not a panacea. There are some people that should not take cannabis or should not take some forms of cannabis in certain dosages. We should figure that out too. Doctors should be able to appropriately, and scientists should be able to appropriately counsel their patients on how to use cannabis. None of that is possible unless you go through the DEA process, which is why we started BRC.
Do we have dates on when the research is going to start coming out?
Some of the research has already started from a agronomic and plant science perspective.
Cool.
These crops will support biotech companies and academic investigators looking at things like the secondhand effects of cannabis smoke,
right.
cannabis for things like chronic pain. How does it help veterans with PTSD?
Epilepsy,
I think we should
Parkinson's,
yeah,
Alzheimer's.
take your pick.
Yeah, exactly.
Take your pick. And we think probably this summer, end of this year, some of that research hopefully should be underway. And
It's awesome.
yeah,
It really is.
We don't want to top anything. What I find, the more you top a plant that's about to be flowered, the more branches it puts out, which means each branch has product of a lesser quality. It's kind of competing with itself and surrounding plants for the light in the room. Yeah, and the nutrients, exactly. So I like to have a single cola plant completely untopped because that focuses all the energy on that single bud. And not only does it promote that bud to be bulked up and increase the yield, but it decreases the competition between the plants.
these plants and their derivatives will go into people, into clinical trials to really understand how to capture the power and the potential of the cannabis plant to actually help as many people as possible. So universities, pharma companies, biotech companies will be taking these plants and their derivatives and in a federally legal way be putting into people to measure their results, which is groundbreaking in the United States. This caliber and quality of cannabis has only existed in the state legal, federally illegal markets, frankly, to date. And we take really, really great care and diligence to ensure, as we've discussed, that they are clean, consistent, and compliant, all the way down to, as you see, the different environmental controls, really monitoring humidity, temperature, inflow and outflow. Some of the background noise you hear is the high positive pressure air. Just like a fish, a contaminant or a mite or a pest won't swim upstream. So we're constantly blasting this room with positive pressure so that if we were to have tracked something in, it's going to get rushed out of the doors versus going to the most prized possession, which is the plants, the medicine that are going to go in into people.
So just about every time that we touch a plant in here, we have to document the details of what exactly we did.
Okay.
So any pruning, any material removal, we have to weigh the product that we removed, and product includes just leaf material, branch material, anything like that. Then log what specific activity we're doing along with the weight. When we put the biologicals out, we gotta record that as well. Irrigation, every day the specific mix that they're being fed is recorded along with the lot number of every component that makes up that irrigation mix. So that allows us, like we said before, to track in the event of a recall of any of our input ingredients, we can track it to the exact product created by that batch that was affected by the recall to then do it with ours as well.
So this must be the most watched cannabis in the country.
The reason we capture all this data, as Kyle alluded to, it's paramount importance to the FDA's perspective. If you're developing botanically derived cannabis drugs, which is what our focus is, It's also just important for good science. A researcher should know every single input of a research material they're using. Does a lighting regimen perhaps affect, does a nutrition regimen affect the quality of their research? Absolutely. What if you could tie a lighting regimen or a fertigation regimen, or even some of the cleaning regimens, you could tie that to a clinical effect perhaps. The cannabis industry is so nascent in terms of meaningful, legitimate clinical data. We have this incredible opportunity to capture everything we know about this cannabis plant and then everything we know about how it affects a different patient. And so that's really important to us, which is why Kyle and his team take such high regard and frankly put such a focus on capturing all of the data.
Thanks, Steph. You're welcome.
You can dispose of the glasses.
Oh, yeah, that's right.
We have our own tank outside that's constantly filled. You probably saw. This system, when it comes time to fill these base stock tanks, it pulls RO water from outside through the system. It injects this 3-part fertilizer mix in whatever ratios we want into the stream of RO water, and it fills these base stock tanks. So we have 3 tanks. The first one goes to every table in the whole facility. This is a backup tank in case anything goes down. This tank is our venture tank, the smaller room that you saw.
Okay.
And then this tank is our flower room tank. So this allows us to give different concentrations of fertilizer to our plants based on the stage of growth.
We're now going to go into our internal QA/QC, quality assurance, quality control laboratory. Cool. We mirror the FDA, the language the FDA uses. So instead of cultivation, it's our production. Instead of laboratory, everything's on the manufacturing side because it's part of our manufacturing process.
Oh, cool.
So we're now in the internal QA/QC lab, the quality assurance, quality control. We have, this is a UPLC, ultra high performance liquid chromatography machine, where we're measuring different levels of cannabinoids all throughout our production process. Again, sort of how this is different from most cannabis farms. Anytime we bring in an input from the outside, be it fertigation mix or a rockwool cube as a growing mechanism or a growing medium, we test it to make sure that it's not contaminated, and then one way we avoid, again, introducing contaminants into the facility is that we open and test those batches of products in a controlled, contained environment, so that if there was some sort of contaminant in an ingredient or one of our inputs, it wouldn't just poof go throughout the facility. It goes into the biosafety cabinet, and so it's not introduced to the rest of the facility. We're in the process, as you can see now, we've moved some furniture around. We're a couple days away from installing a Vanguard supercritical CO2 extraction system. So our whole team on the employee side, investor base, advisory base, director base is all either from federal regulatory agencies like the DEA, like the National Institutes of Health, to biotech executives, pharmaceutical executives as well. So we're really proud to partner with some of the people we have. I think for too long, the traditional scientific and traditional medical community has sort of been watching on the sidelines as the cannabis industry explodes and helps tens of thousands, millions of people. But the scientific community, the biotech community haven't really been able to participate. So they sort of sit back and watch and go from the sidelines, how can we help? How can we dive in? How can we build businesses and companies? They haven't had a chance to do that because they're focused on following federal law. So when BRC came around, we were able to attract really top tier advisors, partners, customers, employees that understand the power of cannabis, but that are explicit that they want to follow the FDA and DEA's guidelines, which is what this place is all about. So we started the business mid 2017, built the facility, built the team, et cetera, and then mid to end of summer 2021, finally got the green light from the DEA to start producing. Now we're in full-scale commercial operational mode. It's really exciting.
So that was a four-year plus commitment before you'd even know it was going to be approved. Wow,
Yep.
that takes cojones, dude.
Yeah.
That takes solid stuff.
There were some stressful, sleepful, I'd say nights, but years, really. But we're exactly where we want to be now. When we started 3 or 4 years ago, politicians, regulators, policymakers didn't really have to have an answer or a position on cannabis. Certainly they were pro-cannabis folks, but the anti-cannabis politicians could just ignore it. They didn't have to have an answer. Now you can't really ignore it. There's so many dollars, so many jobs, so much good, so many positive social equity things that are happening. Frankly, should be happening faster, should have happened sooner. But now nobody can say, most people can't say, hey, I'm exclusively anti-cannabis. Look at children with epilepsy, look at veterans, look at previously underrepresented people in the cannabis industry that are finding a way to elevate themselves and build businesses where historically they couldn't. So it's really, in my opinion, unpalatable to say staunchly, I'm anti-cannabis. And so now, sort of the fallback position is, well, let's look at the research. And we agree, we should absolutely look at the research. We don't prejudge any of it. I think most of the research is going to show that there are dozens of therapeutic potentials of cannabis. And so if you're anti-cannabis and you say, let's look at the research, fantastic, let's look at it. We can do it now. And so we think this is sort of one of the dominoes to fall in the US around cannabis reform is now we can do the research. Now we can figure out how to help the most people. And the facility you've seen today is all about that. I think if you want to show the medical and scientific community the power of cannabis, you have to run the gamut and produce clinical trials to their gold standard. They're not going to change their standard just because people are using cannabis around the states. I think people that hope for that to happen, hope's not a strategy. You have to use sort of their frameworks in order to show them, convince them. That's what we're focused on here. We'll serve whatever scientist, biotech company, pharma company wants around THC. That being said, we see far more demand and interest on medium to high levels of THC, 10 to 20, 10 to 25%, 1-to-1 THC, CBD. So the scientific community has absolutely woken up to the power of THC. And historically, over the past 60 years, they haven't had access to it. So we can provide it. So we're happy to provide minor cannabinoids. We're interested in minor cannabinoids. Right now, a lot of the scientific community that we deal with is really interested in THC. I think probably because it's just been off limits to them for so long.
Yeah.
Cool.
Oh, you got your own little rosin press as well. Though.
Oh yeah.
This is a federal rosin press.
Yeah, it is. Yeah, we're doing some process development.
It's a bottle jack. It's a bottle jack for all of those home growers. Did you guys knock that together, or?
No. We purchased it, qualified it, and we're doing some work around with that equipment right now.
Oh,
developing processes.
I'm very interested. I know so many people that just. Did I tell you about the freeze-dried guy?
Yes, you did. That's amazing.
I've got to introduce.
Send me his stuff.
I will do. See, now you look like Dr. Evil like that.
Dr. Evil. That might stick. That's going to stick.
Do you like cure on site as well?
We do.
You do? Okay,
Yeah.
so you do the whole process all the way to finish.
Everything is here.
Okay.
Extraction as well.
Damn, that's a safe.
Yeah. So I'll start to talk you guys through this. The only thing not to show here, and Lyle will block it with his body, of course, but if somehow the code were to get on.
I literally every facility I've gone into,
Yeah,
people don't even do that. And I'm like, dude, man,
Yeah,
come
on. So Lyle, you want to start opening it up, and I'll talk.
There you go, just stand in front. There you go, we'll just avert the gaze.
Look at the tray.
Gosh, there, look at the weight of that thing.
Over 3,000 pounds.
Yeah.
Oh, it's like
So what you're seeing now is our controlled substance storage vault, which is a requirement of the Drug Enforcement Administration to store and house controlled substances like finished product, finished cannabis flower, etc. So once we do all of our production here in-house, cultivation, extraction, curing, everything, and once it's finished, packaged, processed, ready to be shipped out to a researcher, it lives in here until we drop ship it.
I'm afraid, literally, I'm afraid of walking this.
Oh, no, it's okay.
Someone's just stabbed me like an Indiana
We can go in
Jones.
if you want. Right? Okay, so here's where all the finished product lives before it's shipped. you see here about 30 kilograms of finished cannabis flower. This was, we think, one of the largest imports of cannabis flower into the United States ever. So this came out of Europe. We've got products in here from Europe, Colombia, Uruguay, Canada, Netherlands. Yeah, it runs the gamut. And we
Had Jamaica.
What's that? Yeah, we had psilocybin from Jamaica in here, which was cool. All legal and permitted.
Right.
You know, it's we're building out our process for an international supply chain that we can move cannabis across international lines, across state lines. So part of that is developing and validating a process, finding vendors, you know, airline companies that will actually
that's
fly.
a whole new video. It's the supply chain issue of how
Crazy.
you move this stuff under
Carefully.
DEA laws.
Yeah, carefully and with lots of permitting.
We're basically in this space with just a couple other people and with things like this on our own at the moment.
Right.
They have there's no point of reference for them to deal with.
Right.
It's when you're the country with hundreds of millions of people and we're the only entity doing this at this point in time,
Right.
they don't have things set up for us. So the airlines themselves are only set up for the illicit market since this is not legal anywhere in
Right.
the United States.
And you're talking, I mean, what's the sort of minimum consignment for you guys? It's not like a couple of ounces or something. It's like 50 pounds,
We've
right?
done everything. We've
Really?
done from
Yeah.
like, let's see,
You only need an ounce if you're studying rats.
it's true.
Or insects or something.
Yeah.
No, I totally get that.
I just get a couple pounds to be safe.
Let's see, I'm gonna hold this so you can't see who it's from. But, you know, that came in from the Netherlands.
Decent nose. It's a camera.
And it smells amazingly good for its age. But, you know, that's a small amount of cannabis for a research or an analysis project. You know, put this on an airline and send it with appropriate permitting. But that's not a lot. All right. Well, you need anything from us?
No,
Check here, here. Cool.
Guys, need anything else?
That's it, guys. We'll head back out there. Or Matt, if there's anything you want to do while we're out here. Once we go back out, we'll degown, and then cool. That's all she wrote.
Tremendous facility. I'm so
Thanks,
excited.
guys.
This
Yeah,
is-
it really was. Thank you for letting us in, dude.
Oh my God, I'm grateful y'all are here.
Oh,
Sorry, I'm just
I
putting
was
out
bragging
fires.
to friends that I was going to get to see this.
Oh man, that's awesome.
it really is.
Thank you.
It's,
Top friends, and they're all
Down in little old Monterey.
yeah.
Here we are. It's kind of funny, like putting, you know, it's a big deal. It's a huge deal. We're really pumped, but it's like just down the road from San Francisco. So weed.